Your parents or someone raised you, protected you, and taught you how to live and manage life. Now the time has come to help them. Death is not a subject we like to talk about, but it's inevitable. In their last days, they'll need you to help them with those end of life challenges and decisions. Today, on the Caregiving Doctor Show, hospice care, compassionate care, dignity, peacefulness, surrounded by those they love. We'll talk with a hospice expert on just what is hospice, when is it needed, how does it work, information family caregivers need to know that will help them make decisions best for and with those they love. Hospice care. That's today on the Caregiving Doctor Show.
Hello, everyone, and welcome to the Caregiving Doctor Show. I am your host, Dr. Clarissa Fell Smith, and thank you for joining me today. My guest is Tyshawn Giles. He is a hospice care consultant with New Beacon Hospice, and we're going to be talking about something that's inevitable. We're going to be talking about something that's going to happen to me and something that will happen to you. We're talking about death on a lighter note, hospice. How are you doing today, Tyshawn Giles?
I'm doing well. Thank you for having me today, Dr. Smith.
I couldn't wait for this topic. A very important topic, something that I have personally experienced with my parents, my stepmother and my father that passed away, and hospice was involved. Hospice played a critical role in helping to usher my family into the other side. I want you to know that this topic is so serious that we're going to elevate and we're going to explain the information that hopefully a family member can take this topic and run with your information today and be able to contact you and your agency later on. What is hospice care? What is hospice?
Well, in a nutshell, what hospice is more of a philosophy in regards to an individual with a terminal illness, so that they can have care on a holistic approach of a person. And really what that means is basically spiritually, physically, and socially. So we have team members that go in and work with an individual on every aspect of their life, making sure that they basically have some quality of life, they have some comfort, and they have the assistance that they need going through that terminal diagnosis and transition.
Now, you see this all the time. Are we, for the most part, prepared? You know, we don't want to really go. What are you finding out about family members? Are they assisting their loved ones and preparing to leave the earth? Or what are you finding out here? What are family members dealing with?
Well, it's always a tough conversation, and that's the hardest part, with families coming to terms and grips with where their loved one are in their life. So when they get that diagnosis from their physician that their loved one is terminally ill and they have to go through that process of accepting that, that's always the most difficult part. And so when you call hospice in, with there being some negative stereotypes out there of hospice and what we do, a lot of times we run into some reluctance.
What do you mean? With family members not wanting to accept
family members not wanting to accept that the D word is always a difficult word for people when you're talking about your loved one. No one wants to talk about death. It's not a popular topic. So what we have to do is really get out there and educate the community and really show them the benefits of what we do and how we can help them through their transition. And the goal is really to make it as painless as possible, make it as easy on the caregiver as possible, and also try to help get affairs in order if they have not already been put in order, put together. Just making sure that they have the support that they need and make sure that there's a goal in line with all of that.
So speaking of affairs in order, what are you talking about, affairs in order?
Well, again, being that death is not something that families really want to talk about, just making sure that a patient wishes are known, how they want to go through that transition, then also, even setting up funeral arrangements and things like that. And just making sure that caregivers have a good understanding and can grasp what's going on. So really what happens is hospice coming in, being that support system, not just for the patient, but for the caregivers as well. So hospice in a nutshell works with the patient, making sure that they have quality of life, and then work with the caregivers also to make it as strenuous or stress-free as possible on the caregivers.
How do you know that your loved one may be in the latter part of their transition of life? How do you know? Are there some signs, like with my family members, do they lose their appetite? What are some things to let you know that they may be dying?
Absolutely. That is one of them. Typically, there'll be a lot of more frequent ER visits, maybe some hospitalizations, and even before you get to that, you may start to see some signs of some progressive weight loss that may be going on, loss of appetite. You may start to see more sleeping, activities of daily living may be more difficult, and just the simple things. They may have difficulty bathing themselves or feeding themselves. Also things that I tend to share with physicians. You have patients that come in that are having more recurrent UTIs, more
urinary tract infections.
Yes, I'm sorry. They're having pneumonia often. Things like that kind of lets you know that the body is having difficulty fighting off those infections and things of that nature.
What about mental confusion?
Mental confusion, that's something, especially with UTIs, that is one of the symptoms. They have some confusion going on within them that makes it easier for us to determine that there's something going on and we need to look deeper into it.
So the body starts to shut down and starts to show signs.
Right. It's more difficult to fight off those infections that are going on.
Well, I noticed a team would come in. Talk about your team. I know there's a nurse, there's a physician, but before we talk about that is when you talked about affairs, when you say putting things in orders, with hospice, you can't resuscitate. Is that true? Can you resuscitate if a person is about to pass away? Can you do CPR to bring them back?
Yes, you can. Our staff is certified to do CPR. So if they have not signed a DNR, then we can resuscitate.
So your team consists of?
Our team consists of, from the head down, it's a medical director. And that medical director, what we have is what we call IDT meetings, that's interdisciplinary team meetings. And that physician, basically what they do is in those meetings, they go over every patient that we see. And the nurses are the eyes and ears for the physician. So that physician is always on call, or multiple physicians are always on call, so that those nurses who are the eyes and hands for the physician, if there are any changes that may go on, or they feel like there's something critical, they always have a physician that they can contact to make changes and inform them and update so that they could adjust medications and things of that nature. So from there it goes down, we have aides, home health aides that will go in and do some bathing, and that's really to take a lot of the pressure off of the caregivers.
Yes.
And they find it really helpful. And to be honest with you, our aides are somewhat the backbone of our agency.
I agree.
And they spend so much time in the homes that the family starts to adopt them as their own family. Families, you will see a lot of them actually, when that time comes and any of our patients pass, a lot of the times they'll be at the funerals sitting there with the families, and they're putting the obituaries, and because they've spent the time, have grown such a close bond, and so they're huge for us. But after that, you have social workers who basically go out and make sure that our patients have what they need, resources that they need. Not all of our patients have financial resources and things of that nature, so they may go out and make sure that they have food in home, and they'll look up resources like Meals on Wheels that can come out and bring meals to individuals who really don't have those things. And then also just tapping into other resources like if they were a vet, making sure that they can get VA benefits to assist them. And so they do a whole gamut of things, making sure that the home is a safe environment for them, and if need be, even helping look for residency elsewhere. So they're huge as well. And then on the spiritual side of things, we do have chaplains that go and speak with our patients as well as the families to make sure that spiritually they have the food that they need there as well.
More coming up on the Caregiving Doctor Show. Passionate, loving, caring, nurturing. Looking for quality child care for your little one? Caregiving Kids Academy believes that precious little ones should have the best care. From 6 weeks, pre-K to after-school care, we're with them every step of the way. Now enrolling. Caregiving Kids Academy.
Little leaders, big hearts.
A modern retirement plan is needed now more than ever. Consider the new Safer, Smarter Reverse Mortgage as a way to supplement income and gain financial security. Call Alabama's reverse mortgage guy, Scott Underwood, with iReverse Home Loans with your questions or to request free information. Scott has seen hundreds of reverse mortgages to completion in the last decade while working with each person to ensure their understanding of this safe financial tool. Call Scott at 908-2993.
Here on the Caregiving Doctor Show, our goal is to inform you on topics that are important to you. Topics dealing with senior citizens and family caregivers. If you have a topic you'd like to explore, please visit our website at thecaregivingdoctor.com or visit our Facebook page. Did you know that the Caregiving Doctor is available for speaking engagements, workshops, or seminars? Contact Dr. Clarissa Fell-Smith at 205-201-4096 for your next event.
Welcome back to the Caregiving Doctor Show. My guest is Tyshawn Giles. He is a hospice care consultant. Well, how do you go about respecting the wishes of each person? I mean, for example, if someone wants to be cremated, or if someone is a Baptist,
Okay.
or you got family views that may vary, so you bring the family together, but you know what that person's wish is.
Yeah, we try to, we do a great job of respecting wishes, depending on the denomination of an individual. We've had individuals who didn't share the traditional views, religious views, and we speak with the family. We make sure that we interview with the family, do an education, and anything that they make us aware of, we try to adhere to whatever their standards are, what they would like for us to adhere to.
Okay. Who covers hospice care? Does Medicare, Medicaid, is there a special care cancer program or something?
Well, both. Medicare, Medicaid, even your private insurance can cover it. There's a benefit under each one, but I would say primarily Medicare. According to 2014's stats, about 86% of individuals that are on hospice is covered by Medicare.
And Medicaid is used as a supplement, or if someone doesn't have Medicare and they only have Medicaid?
Yeah, and that number is a lot lower. I think, and I only have 2014 numbers, but that number is a lot lower, and it's about 8%. And then you come in with your private insurances that run about 9% of that.
When you talk about diagnoses dealing with hospice, and I know you see a lot, what are some of the top diagnoses that utilize hospice care? Is cancer number one, or, for example, failure to thrive? What are the top diagnoses?
Cancer would be number one, and I want to say that runs about 35% of what we've seen, 36%. And then from there, it would go to dementia, it would go to heart failure. But yeah, cancer is one that we see often, quite often.
And if you were talking to the families, which you are talking to the families today on the Caregiving Doctor Show, what are some of the challenges, not necessarily accepting it, but dealing with various diagnoses and them understanding the process and the phases that they're going through? So it's not diagnosis specific. It's based on that family's ability to come together during that time. What are some of the challenges that you're seeing with families as they work together from a conflict standpoint? I'm talking about.
This is what I see often. When hospice is entered or introduced to a family, some families don't want to feel like we're giving up, and that's what they feel like when hospice is introduced. and no one wants to feel like we gave up on mom. And I think what's left out sometimes is that they're not asking the patient what the patient wants.
Wow.
And after going back and forth to the hospital, after invasive procedures and different medications that has been introduced to try to cure that individual, sometimes you'll hear your loved one, mom or dad, say, "I'm tired." And no one really wants to take a step back and say, you know, sometimes this is doing more harm than good. Let's get mom home and let's get mom comfortable. Let's discontinue this back and forth to the hospital and this sticking and cutting and that sort of thing. Let's listen to mom and let's just get mom comfortable where all her family can be, and we can make the most out of whatever time she has left. Studies have shown that individuals who get on hospice for those diagnoses versus those that don't are actually living longer.
What do you mean? You're saying when they're initially introduced to hospice care, you're saying with that kind of support, they're living?
Absolutely. Being under the care of a hospice medical director, having those nursing visits to really catch or try to alleviate symptoms before they start to spiral out of control, just having that spiritual support, that social support, and as well as the physical support, they're actually living longer. They're living more comfortably. They have a peace of mind because typically your social worker has come in and worked with you on your plans. And families, patients don't want to leave this world not having worked through a plan or having a plan together. They also want to make sure that their loved ones have accepted what's going on and they have a support system. So it's a good way for patients to really have that peace of mind and to be able to make that transition with some peace.
About what is the average time span someone is on hospice? I mean, what's the average? Is it 6 months, a year? How long can you go on it? How long can you be on it as well?
Well, one of the regulations in Medicare, they want an individual to have a life expectancy of 6 months or less. But you know, like I know, that no one can really determine how long someone has. But what that means is from your physician's expertise, they feel like your disease process runs the course that it's running. If you have a life expectancy of 6 months or less, then you can be admitted to hospice pending that you meet other criteria for that. But once you do that, there are what we call benefit periods, and not to get too technical, basically there are somewhat stopping points where you need to go back and reevaluate the patient to make sure that they can still meet criteria or that they're still declining. And if they are still declining, then they can remain on hospice services. So it can last longer than 6 months. But on average, we'd say that about 71 days individuals are, or what we found is about 71 days individuals are living on hospice.
So you can come off hospice, you can actually improve.
Yeah.
Come off hospice and go back on hospice.
We've had that, and that's a great thing. And if you get better and come off hospice, we call those graduates, which we love. And if it ever reverts back and you go back in the opposite direction, you can always come back on our services.
Great information. Don't go away. We'll be back in just a minute.
A modern retirement plan is needed now more than ever. Consider the new Safer, Smarter Reverse Mortgage as a way to supplement income and gain financial security. Call Alabama's reverse mortgage guy, Scott Underwood, with iReverse Home Loans with your questions or to request free information. Scott has seen hundreds of reverse mortgages to completion in the last decade while working with each person to ensure their understanding of this safe financial tool. Call Scott at 908-2993.
It is my life's work, caregiving. I've worked for over 30 years as an occupational therapist. I'm a radio show, talk show host, book author, and national columnist. Now I'm bringing you other caregiving experts to help you care for yourself while caring for those you love. I'm Clarissa Fell-Smith, the caregiving doctor, because remember, I am caring for you and your loved ones too. Welcome back to the Caregiving Doctor Show. I'm Clarissa Fell-Smith. Since this is the Caregiving Doctor Show, you know I have to talk about caregivers.
Okay.
In my years of working with family members and caregivers, oftentimes the caregiver passes away not long after taking care of someone. They're grieving themselves or that loss and that need to feel needed, but oftentimes they'll pass away years after or a couple of months after. Talk about that a little bit and speak to the caregivers. What do we need to do to help take care of ourselves? Because oftentimes we're exhausted, and when that person is gone, there's a void there oftentimes. So what are some things that caregivers can do and family members can do to help support that caregiver during that time?
Well, I think that's key with hospice, because really that's our goal, to not just take care of the patient, but also take, help, and work with the caregivers. By doing that, by relieving them of some of the daily duties, having those aides come in, that takes some of the pressure off. And also, to get to another thing, we also have what we call respite care.
Respite.
Yes. Respite allows a short stay for an individual that's on hospice services, so that the caregiver can get a break, kind of rejuvenate, because it is an exhaustive thing, caring for your loved one, and so that gives them that break. And you can do that. You can do that quite often. And what happens is that gives them the opportunity to kind of get back to themselves, and so that they can carry on with that. But to go back to after their loved one passed, what our chaplains do, and as well as our bereavement coordinator, what they do is follow a family for past a year.
Oh, really?
And what that does is it gets them past that 1 year anniversary. And what we do is we follow them, we counsel them, and work with them to make sure that they're properly going through the grieving process in whatever fashion that may be, because everyone grieves differently. But we really try to work with them to get them through it. A lot of times what we do is some of the families that we work with, we have them to get them back into helping others and working with others, because they go through this program and they see the beauty of it. They come and they volunteer. As opposed to them focusing on the death of their loved one, they see so much positive in it that they become volunteers for us, and that really helps us out. And they are the great ones that can go and speak with other families and tell them about their experience and help those other families through it.
So it's a great benefit to family members.
It is. When they're at that point and they feel like they need someone to discuss their mom and things that they've gone through with their mom, they have someone to turn to that has gone through this process, over and over again. So I think that's always great and helpful for them to have a voice that has experience just in this area.
And it's so individually based. I mean, every family is different.
Correct. And really what happens through the entire process is that a bond is built, and that just makes it that
turmoil,
much easier.
Not conflict and confusion, but a bond.
Right. And that just helps along through the process. So it's, all family dynamics are different, but the goal of hospice, and especially utilizing your social workers, is really to come in and work with that family and try to get them on a common ground, and work with those caregivers. And we're putting families together. Going through things like this helps put families together.
Well, you're doing a great job.
Well, we try. Hospice is about quality of life. So bringing families together is part of quality of life for an individual, especially one that is going through this type of transition.
Well, thank you very much for your information.
I thank you for having me. It's a serious topic. It's one that families need to have more often, and we need to not shy away from as much as we do.
Say that again. Say it again.
I
love it.
Families, we need to stop shying away from that conversation of death. You said at the beginning that it's inevitable. It's going to happen. So let's face it and let's be smart about it.
Thank you very much for being here. Come back again. I
Thank
love
you-
it. I
thank
love
you
it.
for having me.
Great information. You've been listening to and watching the Caregiving Doctor Show on the Caregiving Doctor radio and television. Hey, you can reach me on social media. Facebook. I'm on various social media outlets. You can also reach me at thecaregivingdoctor.com. But most of all, remember that I am caring for you no matter what it is. I'm caring for you and your loved ones too. And I'll see you next week. Thank you very much.
Today's show is brought to you by Caregiving Kids Academy, Little Leaders, Big Hearts, Scott Underwood, the Reverse Mortgage Guy, and Alabama Reverse Mortgage, Sandra's Designer Closet, and Lewis Harper Jr. and the Harper Insurance Agency. Join us next week for another informative Caregiving Doctor Show.